So the other thing we do involve in here as well, and it's quite close to our heart, is digit or object sucking. And can you quickly just give us, and this is a wide field, but quickly give us some of the negatives of any of those?
Okay, so with digit sucking particularly, and using say a dummy, over time it can change the shape of the palate, but this doesn't necessarily mean because you do it that's what's going to happen to you. Depends on the intensity, the duration and the frequency. So basically, if you
also the position
and the position as well, where they're actually sitting it in their mouth. So a lot of the times a child may suck their thumb, but it might just be to go to sleep. They're not going to have as many side effects as other kids that you see walking around all day, every day, thumbs in their mouth. So there's a lot of things to think about in terms of how bad the side effects will be. A lot of the time when they are thumb sucking for a long time, there could be an underlying reason, could be an airway problem, could be psychological reasons. It's not just they are a thumb sucker.
And sometimes
could be habit.
And sometimes we would actually think of it as actually a can I say life-saving habit?
Yes.
So in other words, if a child struggles to breathe, the thumb can actually open up the airway by splinting the tongue out of the throat. So not, I have to be careful in saying this, not all thumb sucking is bad, but it's kind of an indication of something else going on that we would like the underlying cause to be addressed. So obviously if the child is dependent to have the airway open by splinting the tongue away with the thumb, then we would like to kind of look at that and treat that cause, and the thumb sucking is a secondary event.
Yeah.
So first look at the airway and then deal with the thumb sucking. And that's why I do believe that with any of those habits, it would be critical for some kind of professional to be involved and not just the parents doing research on the internet, as powerful as that may be. There's other diagnostic tools that I think that we need to get involved with in conjunction with other professionals like some throat specialists, GPs, allergists, psychologists,
yeah.
So occupational therapists, because it could be part of that. So we try and involve all those modalities, and if it's not a problem, it's not a problem. If we keep an eye on it, we keep an eye on it, and
the child has to be ready to.
And some children actually, or most children actually, come out of that habit quite naturally as they grow. But we would like to maybe make some of them lives a little bit better, at least.
Yes.
Because those same symptoms that kind of cause the thumb sucking, like sleep disorder breathing, is quite a silent disease, in the sense that most people don't actually know about it and the effect of it. And what the effect of it is on children. So the relation of sleep disorder breathing and something like ADHD or hyperactivity, that most children with those kind of symptoms, sleep disorder breathing is exactly the same symptoms. And people kind of just put that into their, they've got ADHD, and we would like to think of it only if they've got patent airways. So only if the airways are doing fine. So even though that child stopped sucking their thumb, there might be some still of those underlying problems still present that's affecting them to some extent, and we would like to know if that is the case and kind of eliminate those problems from early on. So up to what age do we kind of not, I wouldn't say not worry about it, but we allow for that habit to continue?
I think it depends. It's a different approach if you were going to for a 0 to 4 year old is going to be different approach to 5s onwards, because the developmental capacity, the children they know what they want. Obviously a 4-year-old will know what they want, but they've got more of an understanding why. So you can still treat this from a young age, but you wouldn't put them through a whole serious program. You try and introduce other things like oral play, or just try distraction.
We like to adopt a watchful wait.
Yes.
Yeah, in the sense of, is there something else going on? So we like to adopt let's have a look at them.
Yeah.
And maybe wait.
Yeah.
Or maybe do something, but we'd rather keep them, have them in the system.
Have them there waiting. Yeah.
And if it's fine, it's fine.